So again, Ann mentioned we're going to keep things very informal, and that's definitely the way I want it to be. So if there's questions, raise your hand mid-sentence. I'll make sure that you're answered, because really what this is about is kind of getting this education and getting this information out there. As Ann mentioned, that we are one of the few centers in the area that have this technology available, and we think that we're offering things to our patients that other people are not, and certainly we feel it's a great benefit. So what we want is this information to be disseminated and get it out there. So feel free to ask away. So let's kind of give an overview of what I'm going to be talking about today. So I'll talk a little bit about knee anatomy. Again, we're focusing on the knee. Now, this system does work on the hip as well, but that's going to be kind of a separate talk that would be at a later date with Dr. Stewart, who's been kind of heading that up. But I'll be talking about knee anatomy, basically the arthritic conditions that affect the knee, so the reason that people have joint replacements. We'll talk about ideal candidates for knee replacements, and specifically, of course, the robotic system. And then we'll talk a little bit about the outcomes of robotic and just knee replacements in general. And then certainly we'll have time at the end for any questions. And again, feel free to interrupt. So when you talk about anatomy of the knee, really what we're going to be mainly focusing on is the cartilage surfaces. Okay, so the smooth, white, shiny stuff on the end of your bones. So when you look at this picture here, we're talking about this surface here, the end of the femur, and then the top right here, the tibia. What's not shown here is the kneecap or the patella, and the undersurface of that is also covered by cartilage. So you can have any combination of those areas become affected by arthritis. And really kind of we'll delve into what that means in a little bit. But really it's kind of have an idea of what the shape of a knee is on the inside. So really, what is arthritis? It's just kind of a wastebasket term. Arthritis just means inflammation of any two joints, or sorry, any two bones that come together and articulate. So there's multiple types of arthritis. The most common is good old-fashioned osteoarthritis, or wear and tear. So a vast majority of arthritic conditions we come across are osteoarthritis. There are inflammatory arthritises as well, and there's a whole host of them: rheumatoid, psoriatic, lupus. The list goes on, and those are more mediated by inflammation, often autoimmune problems where the body's attacking its own joints. And a lot of those are treated initially by medicine, but as time goes along, they erode and damage the joints as well. And then lastly, there's post-traumatic. So people that have either a fracture that goes into the joint, or they have damage to the cartilage itself, or sometimes a meniscal damage. Those can all lead to wear and kind of premature wear. And a lot of times when we see younger patients with arthritis, that's kind of what we're dealing with, is a post-traumatic condition. So you know, this is kind of a normal x-ray of a knee, an AP x-ray of a knee. So again, here's femur. You can see the little circle right there. That's the kneecap. Tibia down here. Nice little joint space. And what that is, of course, it's not air sitting there. That's the cartilage. So when an x-ray looks, it can pick up the bone, but the cartilage is there, and it looks like a gap, and that's what you want, nice healthy gaps. But as life goes on, eventually you get x-rays that look like this, okay, which is not so pretty. So you see a very classic looking osteoarthritis. Now this is actually pretty severe. As you see, there's erosion down in the bone, irregular surfaces. But really that's what osteoarthritis is that you get the wearing down of the cartilage surfaces, then you get the, quote, bone on bone, the grinding away that happens. And people get the very classic symptoms of stiffness, pain, decreased range of motion. And so that is osteoarthritis. So this is kind of a cartoon picture of what it looks like, but in reality it looks pretty similar to this in real life. You have areas of cartilage, and then you have areas of exposed bone. And even on the most arthritic knees you can imagine, usually there's still some areas that have cartilage left, but there's large areas of exposed bone, and really that's kind of the mediator of the problems that we see in the knee. So, and then there's a specific thing when we're going to be talking about partial knees, are patients who have arthritis that's only in one area of the knee, most commonly the medial or inner compartment of the knee, and those are dubbed unicompartmental arthritis. And those are patients often who have a malalignment, in this case of varus. So if you look at this leg, they're walking bow-legged. Sometimes it's unilateral. Sometimes you see the patient or people that look like they just got off a horse. They could throw a bowling ball between their legs, but that's where they have bilateral varus malalignment. And their x-ray is going to look very classical like this. Well preserved on one side, bone on the other. Okay, and those are patients that may be candidates for partial knee replacement, which we'll talk about as well. So, you know, when you have patients who you're talking to or seeing them for the first time, or patients, you know, just kind of out in the community talking to people, you know, they often ask, like, when am I ready for a knee replacement? And really the first thing is you have to understand what you're treating. So